Hello, my dear friends. Today we are going to talk about a very interesting topic. We are going to talk about salary of doctor in India after completing his MBBS. So, how much a fresher can earn when he completes his what MBBS? After completing its MBBS, doctor. Doctor is the most noble profession that anyone can choose, and very few has the chance to pursue this noble career path. But 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 being a noble but being just being a noble career doesn't gonna you know fill your stomach. So some money comes with it. So I'm gonna tell you that how much money can a doctor can earn after completing its MBBS, and what are the paths he can take after completing its graduation. So there are four paths that I have given. I'm not talking about the SR, senior, post graduation. Not I'm talking about just the job path. Job, what are the job that he can take? I'm not talking about going for the further studies, not talking about the clinical research that he can done. I'm talking about what are the professions, what are the jobs that he can do to earn money without going in further studies. First thing he can do is to do and give combined medical service exam that happens per year, and it is done by UPSC. Combined medical service exam by UPSC. Or he can do work in government hospital, or he can do work in private hospital, or he can open his own private clinic. So we are going to talk about these four things. So first talk about combined medical services, CMS exams by UPSC. It happens every year. It happens every year, and it is it is conducted by whom? By the UPSC. By UPSC. By UPSC. On this exam, you can see there are going to be there are around less than 1,000 seats, 1,000 seats per annum, less than 1,000 seats. So there are less seats. These are less seats. So the competition on them are huge. On the competition on them is huge, and if you clear that exam, you will become a civil servant. You can say you can be of central government civil servant or state government. You can work as a medical officer, as a medical in a medical line, or in a administrative capacity, And if we talk about the salary that you can get on starting, that ranges from 50K to 1.8 lakh, not annum, per month. The salary you can get after clearing this exam. This range depends upon the which post that you have cleared the exam for, After, let's talk about government hospitals. There are two type of hospitals. One are state, and another are what? Central. State and central. If we talk about central, I'm going to talk about where I live, that where I know. Let's talk about Delhi. In Delhi, on average, a central government doctor that joins the that joins the hospitals after completing its MBBS gets around 80,000 to 1.05 lakh per month when he joins, and in state he gets around 90,000 to 1.1 lakh per month. This difference is because of the taxes that they have to pay. The exams, the taxes. So this is the state and central government. As you go from north to south, there is a dip. There is a dip in this salary. There's a dip in the salary. In Kerala, this range is, you can say, 30,000 to 50,000 per month. In Maharashtra, it is from 40,000 to 60,000 per month. So there is a dip as you go from north to south. There's a dip on this thing. Let's talk about private hospitals. In Delhi, if I'm talk about, they can be offered 90,000 to 1.4 lakh per month. This salary depends on what? Depends on skill the newcomer have. If they are gonna pay that much, they are gonna expect so much also. So in private hospital in Delhi, the salary is around, for the new freshers, are 90,000 to 1.4 lakh per month. If we talk about private hospitals, if they are gonna give you that much, they are gonna expect some things from you. So this depends upon the skills that you have. Okay. This depends upon the skills that you have. And if we talk about private clinics, the salary in this thing depends upon geographical factor. What is a geographical factor? Where you have opened your clinic, geographical factor. Second is your engagement. How's your engagement is with the patients or the public. Third, your success rate. How success your cures are. That with how much success you are healing the patients, and your skills. This all things counts in private clinics that you open and you do practice. Okay, that you do your practice on them. So its range can be from 7 lakh to 1.5 crore per month. 7 lakh to 1.5 crore per, not month, per year. Totally depends upon you. Geographical factor, your engagement, your success rate, your skills that you have. There is no cap on this thing. There is no cap on these things. So I hope you understood my point. See you soon in the next lectures. Till then, take care of yourself. And this profession is not all about money. This is about how you serve the humanity. So make sure when you do study, you have that thing in your mind. Thank you.